A lot of people ask me about how to correct their posture. Young and old, men and women, it seems that neck hump, hunchback, and forward head problems are becoming more common. The medical term for this postural problem is hyperkyphosis. Hyper means in excess, and kyphosis is the name that we give to the curvature of the thoracic spine. It is normal to have this curvature. The problem is when the angle is greater than 40 degrees. Here are some questions that people ask me. Is bad posture a sign of a serious disease? My doctor told me that I have a fat pad on my upper back. Can I remove that with diet? Can bad posture lead to back pain? Is bad posture caused by large breasts, and will breast reduction surgery improve my posture? Can bad posture affect my lung capacity, digestion, or heart function? Are bad posture correctors any good? And does exercise really correct a bad posture? Today, I'll answer these questions and I'll demonstrate some exercises that you can do to improve your posture. So, let's talk about hyperkyphosis today. First, let me explain to you the various types of hyperkyphosis. There is a lot of confusion, even among medical professionals, about what can be treated by exercise or not. Not all posture problems can be fixed with exercises. Hyperkyphosis can be fixed or flexible. If it is fixed, there is no exercise that will correct it, only surgery. Before I continue, let me remind you that this video is not intended to replace medical advice. It is for educational purposes only. If you need medical advice, contact your doctor. And in case of emergency, go to the nearest emergency department or call 911. Buffalo hump or dowager's hump is not the same thing as hyperkyphosis. Buffalo hump is a fat pad in the upper back region. Sometimes the person doesn't even know that they have it. This fat pad is a sign of hormonal problem, most likely excess of cortisol production or when taking medications containing steroids like prednisone. This fat pad accumulates in this region and does not cause any pain. It is just an aesthetic problem. If the person wants to get rid of this, first they need to check their hormones. This type of fat does not go away with diet, and the only way to remove it is by liposuction or surgical removal. There is another type of postural deformity that does not get better with exercises. This is caused by fatigue, depression, exhaustion, or low self-esteem. The person assumes a body habitus that express their emotions and feelings, and they need psychotherapy more than exercise. Although all types of exercises are also helpful to improve mood and self-esteem. The other type of hyperkyphosis that does not respond well to exercises is when it's caused by vertebral fractures. Most commonly, it's caused by osteoporosis. The vertebra breaks and the spine starts getting deformed with the head protruded forward. To treat these postural problems, there are some treatments with, for example, injections of cement in the vertebra or even surgical strengthening with screws and rods. We only recommend surgery when the hyperkyphosis is affecting the internal organs like the lungs, or when there is too much pain that does not get better with strong painkillers. There are some diseases that affect the spine and also cause hyperkyphosis, such as Sherman's disease that starts in childhood. Also, ankylosing spondylitis, which is a type of arthritis, Marfan's syndrome, Ehlers-Danlos syndrome, and some neuromuscular diseases. There are also hyperkyphosis that runs in families. It is a hereditary trait. If a person has both parents with hyperkyphosis, that increases their chance of having this deformity, and this is not a disease, it's just the way they are, and they are perfectly normal. Now, there is a type of hyperkyphosis that is flexible. There is no other explanation for the deformity except for a bad posture. And this is the type of problem that resolves with exercises. How do you know that your kind of kyphosis the person has? Is this a fixed deformity that does not get better with exercise, or is it a flexible postural problem? Well, the doctor can order an X-ray of the spine and ask the radiologist to measure the Cobb angle. This is the angle that we measure from the top of the 4th thoracic vertebra to the bottom of the 9th thoracic vertebra. The patient has to take the X-ray standing up and trying the best upright posture possible. If this angle is bigger than 40 degrees, then there is kyphosis in excess or hyperkyphosis. Another simple way to find out without taking an X-ray is by measuring the occiput to wall distance. This is the occiput to wall test that you ask the person to stand straight close to a wall, touch their pelvis and their shoulders there, and usually when the person has a fixed hyperkyphosis, they can't touch this bone, the occipital bone, on the wall. And what you do is you just measure this distance in centimeters. So you put a ruler here and you measure what is the distance between the wall and the occipital bone. The occipital bone is here. And as you do some exercises or surgery, or you do other treatments, you will see that this will get better and the person will be able to touch the occipital bone. Now, if the person can, when you ask them to do this, if the person can already touch the occipital bone, the shoulders, and the pelvis on the wall, it means that they have a flexible hyperkyphosis, and all they need is exercises to strengthen the abdominal muscles, to stretch the pectoralis muscles, to strengthen the rhomboid muscles. And as long as they don't do this, so when they are doing the occipital to wall test, if they do this, they're cheating or doing this. But so the nose has to be pointing forward, and if they can touch the wall, then it's a flexible postural problem. Another simple way to find out is the block method. You ask the person to lie down on the floor with the nose pointing to the ceiling. If the head cannot touch the floor, you add some books under the head and measure the distance, the height of these books in centimeters. It's the same idea of the occipital to wall test, but with the person lying down. Once we make the diagnosis of a flexible hyperkyphosis, it's time to work out on that posture. Even if the person has fixed hyperkyphosis, they can do these exercises to avoid worsening of their deformity. The first thing is to pay attention to the height of your pillow and the firmness of your mattress. If you are a back sleeper and your pillow is too high, then you are constantly pushing your head forward. You need a lower pillow. If your mattress is too soft, your pelvis is heavier than your chest, and your tendency is to sink at the pelvis and curving your chest. You need a firmer mattress. The second thing to pay attention to is the workstation. If you spend too many hours in front of a computer, or doing manual work, or doing crafts, or just browsing on your cell phone, be mindful and take breaks. it is important that you change positions and do some of the exercises I'll show you during your breaks. And do not waste your money buying braces or spinal supports to correct your posture. They are not a good substitute for exercise. These are passive modalities and they just enable your body to be lazier and weaker. So forget about them. The only exception is for children and adolescents who have some spinal diseases and they need special types of braces. For example, like a Milwaukee brace that is especially designed to prevent the spinal deformity and disease to get worse. So now let me show you some exercises that I recommend for people with hyperkyphosis. So this exercise is called chin tucks, and it's excellent for correction of hyperkyphosis, thoracic back pain, and it's so simple to do. So what you do is, usually the person will have a posture like this with round shoulders like this and the head protruded forward. And what chin tuck is, you try your best posture, bringing your shoulders back, and you will see that the ear is aligned with the shoulder. And then what you do is bring the chin inside, chin tuck in. So one of the secrets of doing this is always pointing the nose towards the front. So don't look up, don't look down, this is cheating. And when you just pointing your nose straight forward ahead of you, you just tuck the chin in and stay there and try to stay in this position and shoulders backwards and stay in this position for about, hold it for 5 seconds, 10, maybe 30 seconds or 60 seconds. But remember, you can even put your finger here, and because this will remind you to keep your chin tucked in. So the other exercise is also very simple. It's standing. Try your best posture. And when you do this, you would just do back extension. So you go back, backwards, and you are going to look at the ceiling and relax your shoulders here and look at the ceiling and come back. So best posture first, try to be aligned, and then start curving backwards. Backwards, your lumbar spine go forward, your thoracic spine go backwards, and your neck go all the way there. Okay, so this is the opposite of what you have been doing the whole day. Like if you have been in this bad posture the whole day, now you take some breaks, and when you take breaks, you are going to, you can even put your hands here and go backwards. This is a standing back extension exercise. So this exercise is push-ups, but we're going to do push-ups on the wall. So you go apart from the wall and you're going to go forward. It's important that your spine is aligned with your hips, that it's like a straight line. So don't do this because it puts too much pressure on your spine. What you have to do is this, and bring your face close to the wall and do this 8 times. And then what you can do when you finish is try to squish your shoulders against the wall. So try to touch the shoulders, the back of your shoulders on the wall, and squish, squish, squish. So then you're contracting the rhomboids and getting the shoulder blades close to each other. So do this and squish and relax. Excellent. So now we're going to start doing the stretching exercises. And the first one we're going to do is stretching the pectoralis muscles, or the pecs. And the pecs have fibers that are lower fibers, medium fibers, or upper fibers. So we need a doorway. And what you're going to do is to stretch the upper fibers, you're going to keep your elbow down like this. And what you do is you move your body backwards. So just keep the elbow here, don't move, and just keep doing this, and you should feel stretching the pecs here. Keep doing this and just stretch, stretch, stretch. You do a good stretch here. Come back, and you can do this 8 times. Stretch and stretch. Leave your elbow touching the doorway. Don't move it. And then, to stretch the mid fibers, you put your elbow at about 90 degrees here with the shoulder, at the same level at the shoulder, and do the same thing. You go backwards, and then you feel stretching. You feel all these fibers stretching here, and it should not hurt. If it's hurting, then you don't need to do it. And stretch, 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 and move your body backwards. That's good. And then the last one is to stretch the lower fibers. You should be putting your elbow, your hand and elbow all the way up, and do the same thing. Then you turn your body away from the doorway, and then you'll be stretching these muscles there. Okay, and you're stretching also the latissimus dorsi and the pectoralis muscles. So you're going to lie down on your stomach, put your hands in front of you, and this is called the sloppy push-ups. You're going to do this, and you can do 8 times. You see you're extending, bending forward the lumbar spine. 4, 5. It's important that you keep your hands in front of you. 6, 7. Do 8 times. And then if you can, the next day you can increase to 12 times. And if that's easy, you can increase to 20 times. And another exercise that is to strengthen the muscles in the back, the paraspinal muscles, is the Superman position. So you just go flat on your stomach, and then you go up, arms and legs, and you stay there for as long as you can. Again, if you can tolerate 15 seconds the first time, that's perfect. If you have never done this, that's very good. But if you start doing this more regularly, you'll be able to hold it for 30 seconds, and then the ideal is 60 seconds. So you can start taking notes of your progression, how you progress with these exercises, your routines, and then you start taking notes of how many seconds you can hold each position, and you see that you are getting better. So these exercises are the rolls. If you have some elastic bands like this, you can hold them in a doorknob or the legs of a table. And they come in different strengths. These are light ones, but you can buy them stronger, so you have to do more force, to apply more force. This is not too hard, but you can buy different strengths. And this is good also to strengthen the muscles, the rhomboid muscles here on the back of your spine, and help you with the posture. So what you'll be doing is roll, and you can roll like this, relax your shoulders. You can also do rolls like this, here. You can do many different exercises with elastic bands, but for posture problems, this is mainly what I like to recommend you to do. Rolls, and you can hold here, hold, and release, you can repeat this 8 times. And then when this becomes easy, you increase to 12 and 20 repetitions. And this is an excellent exercise to strengthen the rhomboid muscle here in the back of your thoracic spine. If you want to read the script of this video, there is a link in the description below. So now I'll answer the other questions that I mentioned at the beginning of this video. Well, if the person has upper back pain, it is important that they see their doctor, okay? It can be one of the serious conditions that I mentioned above, or it could be just myofascial pain syndrome, and the muscles are so weak and overstretched that they have trigger points. If you have upper back myofascial pain, I have a video that I show how to treat this type of pain. Well, enlarged breasts may lead to bad posture and round shoulders, but it would be very rare that the kyphosis or hyperkyphosis cannot be corrected with postural exercises. And when you measure the Cobb angle of a person with enlarged breasts, if it is bigger than 40 degrees, then it might be that the person also has other health problems like osteoporosis with vertebral fractures. And what about the lungs, digestion, and heart? Well, yes, these internal organs can be affected in severe cases of hyperkyphosis, especially when it's fixed hyperkyphosis. When the person starts having symptoms of organ compression, it's time to think about surgical correction. Well, if you like this video, press the thumbs up here. Don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos. Watch my next video here. Goodbye!